We recognize that first aid remains a crucial skill even as the country deals with the COVID-19 pandemic. We've put together the below advice for first aiders so that you can continue to keep those you care for and yourself safe. As a first aider, in addition to high-quality clinical skills, to be effective, you need to 1. Be aware of the risk to yourself and others. 2. Keep yourself safe. 3. Give early treatment. 4. Keep yourself informed and updated. 5. Remember your own needs. In the current climate with the prevalence of the COVID-19 pandemic, these skills become even more important.
Welcome back to Focus on Health. In case you're joining us right now, our topic today is hepatitis, the silent killer, and with me on set is Dr. Mutinda from Bliss Medical Hospital. So Dr. you were talking about hepatitis. Does it have a cure?
Yes, depending on the cause, but they're all very different. So hepatitis is still the general term, but each of them has their own specific treatment.
Okay, could you kindly take us through that?
Yes, so for the hepatitis A and E, these are self-limited. They're self-limited illnesses, they'll just pass with time. But you still need to, depending on how severe you've been hit, you may have to go to the hospital, maybe have some fluids put up. You need to be isolated from the public because, like with many illnesses, not everyone manifests them. So children are particularly known to have the illness but not manifest any symptoms and are kind of spreading it silently.
So both A and B technically have cures?
They basically just pass on their own with some time. Should someone be healthy, the risk is if someone's immunity isn't too strong, then they're in quite a bit of problems.
What about now the rest, B, C, and D?
Yeah, so for B, so D basically technically needs, it's complicated, but D needs B to be there, to be infected. There are medication that helps keep them under control, but I wouldn't say there's a definitive cure yet.
Okay.
Yes.
And C, does it have a cure?
No, it's the same. You have to, there are medicines that are given to modulate, to help your immune system fight them off and keep the numbers down so that you're not infective and the disease isn't progressing quickly and you're getting unwell.
So basically, once you get hepatitis, you just have to live with it forever, or are there measures that can be put in place to help you?
So for the viral ones, you just need to take the medication as prescribed, follow the doctor's instructions, and I think you should be okay.
And Shari, how do you go about the diagnosis? What method do you use to detect hepatitis in the blood?
So the diagnosis doesn't necessarily start with the test itself. We start with the medical history. So when you present to a hospital like this, you will be given a session to speak with the doctor where you present all your symptoms. They'll ask you some questions, of course follow those up. So we call that the medical history. This is followed by a physical examination where the doctor checks for some of those signs, so like the yellowing I was telling you about earlier, if there's any pain on the stomach, things of the sort. And then now following that, we do a blood test. So where we check for the enzymes of the liver, among some of the other things that the liver makes. You can actually check these levels and tell if someone is affected or not.
Okay. Dr. apart from what we talked about the toxins, we also have autoimmune hepatitis, whereby the body is now your enemy. What causes that, and how do you go about it?
So autoimmune illnesses are still a bit of a mystery, but what tends to happen is that the body it mistakes. It either mistakes some of the parts of your body as an enemy, or some of the solutions it creates, like in terms of antibodies and things, those complexes get deposited in the liver. And basically these are signals for the immune system to destroy something. So wherever it's deposited, it will be destroyed.
Dr. of course, you've experienced hepatitis. How do you think there's a possible cure for hepatitis even in the future?
I mean, I have a lot of faith in us as humanity. Many things that we haven't been able to deal with in the past, we've been able to deal with over time. So with these things, I'd say it's just a matter of time, funding, research, the number of people working on it, and eventually we will come up with a cure.
Survivors of hepatitis?
Yes. Depends on how, of course, the treatment goes. The infection actually just basically disappears. We call it latent. So the immune system and the medication suppresses the infection, and they're not showing any symptoms. They still have it, but they're quite okay. They can continue living a normal life. But unfortunately for others, it progresses, it worsens, and at that point they'll need more and more advanced care to help them.
If you've contracted hepatitis, what are some of the steps that you can take to prevent it from becoming worse?
Follow the doctor's instructions, observe hygiene, take your medication if you have to do it, because some of these challenges, some of the medications have to be taken daily.
Actually, does one have to change his or her diet?
Yes, you do. One of the functions of the liver is to create certain proteins that are needed in the body, and if you're actually quite so unwell, the test will actually tell us whether you're able to make these proteins or not. And if you're not, you may have to actually supplement them in the diet. Yes.
Actually, there's a lot of stigma that comes with hepatitis, maybe even as you socialize with your friends, with your partners. How can one cope with that, or rather, how would you advise them to cope with that?
Well, I understand there's a lot of fear, but we already know how the expositions tend to happen. So with the viral kind of hepatitis A and E, those ones actually you should actually keep your distance until someone is well, because you could easily get unwell. With the others, as long as you're taking the medication, as long as you're following the doctor's instructions, your risk should be much lower. And of course, those who are close to you should be reassured of the same, so that they're not alienating you as you're getting your treatment.
And are there vaccines available for hepatitis? And
Yes.
Not get that risk?
Yes. For hepatitis A and B, vaccines do exist. I don't know if A exists locally. I'll find out about that. But yeah, you can get, it's actually even recommended for people to generally get the hepatitis B vaccine.
Is it available for all age groups, or is it a particular age group that can only access it?
I think from age, like, I want to say like 10 onwards, once you're done with the childhood immunization and you start interacting with the one, yeah,
So
you should be able to get it.
As an adult, you can't get this vaccine?
No, you still can.
Oh,
You still can.
Okay.
If you had it before as a child, maybe as an adult, you'll just get like a booster shot just to, augment the immune system again. Yes, but you can still get it.
What are some of the challenges that patients suffering from hepatitis face in terms of cost for the treatment?
Yes, so unfortunately, if the disease does progress and they reach what's known as liver failure, they may have many frequent admissions. Because their health will just deteriorate at any point. The mental state may not be the best, and eventually, because the organs are really dependent on each other, failure in one could cascade into failure into other organs, and these people just need to be in the hospital quite a lot. Yes, and it's quite expensive.
Why is hepatitis so silent, yet it has infected so many people in the country?
Like we said earlier, some of the symptoms are non-specific and they're slow, and you'd find that the damage happens slowly over time before something actually manifests. So that presents a challenge in the detection of it.
Advise patients to take care of themselves, or even basically the family and the friends. How do they support people suffering from hepatitis?
So to take care of yourself, you can take preventive measures. Right now, I feel like I hope everyone is being a champion in terms of hand washing, sanitation. That will help you prevent like the hepatitis A and E. With the B, you can get the vaccine. Of course, you can get in touch with your healthcare provider. You can also contact us. I'm not sure. I have to check out that one. I'm honestly not sure about that.
Are there any more measures they should take?
Yes, just to be careful. Of course, if there's someone that you're having any sexual contact with, or who's in close proximity with you, if they're showing any symptoms, of course you can have them checked out. But it's also just to be careful about your own personal exposition. The areas you've been, of course, like we discussed, if you're getting tattoos or any body work done, just making sure that they take, precautions to ensure that there's no risk of one person infecting another one.
Apart from body flu, is it about body contact? Can that also contract hepatitis?
No, unless the fluid has a way to make it into your body. Any exposed surfaces or any any cuts or anything like that, no, the risk should be lower.
And other people living with hepatitis, but maybe the virus as carriers, but they're not really sick?
Yes, definitely there.
Okay. So how do they not get to contract it to other people?
In the same ways. So for example, but this is more for like the hepatitis A, like with the children. With the others, over time, the signs will start manifesting. And it's only someone who's taking the medication and kind of goes into remission that they'd be living quite okay. Yeah.
Actually, even as we wrap up, could you kindly give us a few closing comments to our viewers on hepatitis?
Yes, so hepatitis is one of those silent illnesses, but taking care of yourselves in terms of hygiene, if you can get a vaccine, please do so. Another very common one in this country is the alcoholic hepatitis. So just making sure that you cut down on the amount of drinking, make sure that you're not going excessive, having more than 4 drinks in one sitting will actually reduce your risk of catching the same.
That is all the time we had for today. I hope you've learned a lot about hepatitis. I've been your host, Bari Michelle. Stay safe and stay healthy. I will leave you with a healthy segment.
Tips to avoid liver damage from hepatitis. People with hepatitis need to follow a healthy lifestyle to minimize damage to the liver. Start protecting your liver by paying more attention to nutrition. There is no special diet for hepatitis, says Kerry Gens, RD, a registered dietitian in New York City and spokesman for the American Dietetic Association. A person with hepatitis just needs to follow a healthy, well-balanced diet. The diet should include plenty of fruits and vegetables, whole grains such as oats, brown rice, barley, and quinoa. Lean proteins such as fish, skinless chicken, egg whites, and beans. Low fats or non-fat dairy products. Healthy fats like those in nuts, avocados, and olive oil. Avoid the following. 1. Saturated fats found in butter, sour cream, and other high-fat dairy foods, fatty cuts of meat, and fried foods. 2. Sugary treats like cookies, cakes, soda, and packaged baked goods. 3. Foods heavily laced with salt. 4. Alcohol.